Hello Shemai, Owain Wyn Evans here. Congratulations to all of the finalists in this year's Howells Applause. I just wanted to say a massive thank you, diolch yn fawr to everybody who works in the Hywel Dda University Health Board for the great work you do to provide NHS services to our communities here in South West Wales. The outstanding compassion you show to the public daily really is incredible. So thank you to each and every member of staff and volunteer. Your work really does make a huge difference.
Hello, my name is Judith Hardesty and I'm the interim chair of Hywel Dda University Health Board. I'm here to talk about Howells Applause, which is our staff awards event, and it's a celebration of the dedication and achievements of our workforce who've made a real difference to the people we care for, their families or work colleagues. After the success of the event last year, we have listened to staff who've given opinions on what worked well and what we could change. So there are a few changes from last year. Also, a new category has been introduced, which again has come forward from suggestions for future awards. And I'm really pleased to announce the People Development Award. And the executive sponsor for that is Lisa Gostling, our Director of Workforce and OD, and she will explain a little bit about that. A large number of people strongly agreed that having the opportunities to recognise colleagues is really important to them. So I want to take the opportunity to remind everybody about Howells Applause, as well as the Chair's Commendation Awards, which run throughout the year. And they recognise exemplary practice against our values. There's an award there for compassion, for collaboration and innovation, and for development. And it's always an honour to present those awards. So if you haven't been involved in nominating for those Chair's commendations, then please do get involved. We've always been absolutely amazed at the high standard of entries and how our staff truly live our values every day.
Awards can include things like trophies, certificates, plaques, and offered to employees who often display a sense of pride in their work and become more engaged, either as an individual or a member of a team. When employees are rewarded for skills and gifts that are utilised in a way that brings comfort and their behaviour is aligning to values of their organisation, then they will achieve something for themselves. Wrth yn gasglu at unrhyw achlysur, yn enwedig pan byddwn yn dathlu, rydym bob amser yn fwy ymwybodol o bobl sydd ar goll. Felly cam gyfle i gael eiliad i fyfyrio, i ddiolch am bobl sydd wedi bod yn rhan o'n bywyd gwaith, yn ogystal â teulu a ffrindiau sydd wedi cydgerdded a llunio ein bywydau ni. It is my privilege to invite you to observe a moment of silence, and the intention and our privilege at this ceremony is to honour colleagues who have passed away, either in service or perhaps soon or some years after they have left the organisation. As I record, I have lit the eternal flame in the form of a memorial candle. And the tradition of lighting a candle has been embraced and transcends countless cultures and faith, and unites us in our sadness and grief to celebrate individual lives we remember in this ceremony, as we universally and symbolically remember the love and ask for healing. Let's take a moment to remember those beloved colleagues, friends and family we find that remain strongly in our hearts.
Shemai, my name is Andrew Crothers and I'm the Director of Operations within their Health Board, and I'm the Executive Sponsor of the Living Our Values Award. Here in How Thy University Health Board, we know the value of being in a great team with a strong positive culture that enables people to be themselves at work and perform to the best of their ability. This award is to celebrate teams that embody our values and have developed a great culture that is compassionate and supports everyone, has strong collaboration and communication, is values driven, and ensures that all team members feel valued and appreciated. I will now hand over to Karina Lloyd-Jones, the specialist panellist for the Living Our Values Award, to present the finalists.
Shemai, I'm Karina Lloyd-Jones and I'm the Head of Organisation Relations. Thank you to everyone who took the time to submit a nomination for the Living Our Values Award. The finalists in no particular order are Executive PA Management Team, Kelly, Susona and Bethan Dunn. Kelly and Bethan are incredibly supportive of their team and have put a range of things in place to ensure a supportive, compassionate culture. They have put together a skills matrix which enables the PA team to see which one of their colleagues can go to for expert advice if needed. Rheumatology team, Withybush Hospital. The team are welcoming and supportive. They take time to listen to each other, whether it be about professional or personal scenarios. Each member of the team can be their true self in the workplace as they are inclusive and non-judgmental and value the diverse qualities, backgrounds and personalities of each team member. They regularly share a hot drink, cake and biscuits, and of course bring humour into the workplace to lighten the mood. In a fast-paced and pressured work environment, the team help to motivate and uplift each other. Sometimes work can be stressful, so the team members look out for each other and take time to go on a walk together in their break time or have a chat and a laugh to relieve stress levels. Team Begelly, Pembrokeshire. Team Begelly have taken time to get to know one another and show their appreciation with humour. A lot of the team have worked together for decades and are responsive, adaptable and compassionate. They are happy in each other's company and this enables them to provide the best possible care for their patients. Llongyfarchiadau, congratulations to all the nominees and finalists. I'll now pass you back to Andrew to announce the winner of the Living Our Values Award.
The winner is the Executive PA Management Team. This team were nominated several times for this award, which highlights the impact working in this supportive team has on its team members. Both Kelly and Bethan have worked hard to ensure that there is a positive working atmosphere within the PA team, not only between the PAs, but also the executive directors. They are incredibly supportive and role model compassionate leadership. They have put several measures in place to build the collaboration and communication in their team and ensure that team members feel valued and appreciated. Congratulations to the executive PA management team, and thank you to their colleagues for nominating them and sharing the positive experience of working in the team.
Shwmai, fy enw I yw Alwena Hughes Mopes, a dwi'n gyfarwyddwr cyfathrebu ac ymgysylltu yma yn Hywel Dda. A gen I mae'r fraint o fod yn noddwr gweithredol gwobr yr iaith Gymraeg. This is an award for an individual or a team who has demonstrated dedication and commitment to the promotion of the Welsh language. It recognises staff that go beyond the Welsh Government legislation and supporting our colleagues and patients in the use of the Welsh language. Nawr draw at Emma Evans, yr aelod arbenigol ar y panel ar defnydd gorau o'r Gymraeg, fydd yn cyflwyno'r rhestr fer.
Shwmai, Emma Evans I fi, uwchswyddog iaith y Bwrdd Iechyd. Diolch I bawb am rhoi amser I gyflwyno enwebiad ar gyfer gwobr defnydd gorau o'r Gymraeg. Fe gawsom rai enwebiadau cryf sy'n adlewyrchu'r ymroddiad gan staff ar draws y Bwrdd Iechyd I hyrwyddo a defnyddio'r Gymraeg. Shortlisting the award was difficult for myself and for other panellists, but we were looking for a team or individual that have gone beyond the statutory duty to support colleagues and patients to use the Welsh language, is a role model for the Welsh language standards, promotes the use of Welsh language externally or internally, and this person may not be fluent in Welsh, but makes every effort to use the Welsh language daily. So in no particular order, our finalists are Rose Harris, Community Psychiatric Nurse, St Brynach's Older Adults Mental Health Team. Rose supports the team with Welsh language translation and learning Welsh. As a Welsh speaker, Rose is able to support patients through the medium of Welsh when requested or required. This is vital in ensuring that the patient is effectively able to be understood and have their needs met. Jen Evans, Undergraduate Officer, Bronglais Postgraduate Centre. Being a fluent Welsh speaker, Jen Evans promotes the language by encouraging team members to develop their confidence using the language. Nicola Drake, Emergency Department Consultant with Bush Hospital. Nicola has moved to the area from London and has been learning Welsh within her local community. She uses her Welsh daily in work with staff and patients. In a high-pressure environment, this individual can remain jolly and practice their Welsh. Llongyfarchiadau bawb y gallu enwebu a bawb a gyfeiddodd y rownd derfynol. Wy nawr am trosglwyddo nôl I Alwena I gyhoeddi enillydd y wobr defnydd gorau o'r Gymraeg.
Diolch Emma. A'r enillydd yw, the winner is Jen Evans, swyddog Israddedigion yng Nghanolfan Uwchraddedig Bronglais. Jen Evans, Undergraduate Officer, Bronglais Postgraduate Centre. The impact of Jen's work in promoting Welsh language in her workplace includes improving colleagues' understanding of the Welsh language, and not only in the workplace, but in everyday life. Staff and students appreciate being able to speak Welsh with Jen, especially if it's their first language. Staff who are learning Welsh are also able to ask Jen, how do you say this in Welsh and what does it mean? Which highlights how much of an asset Jen is to the language, her department, her team and our service users. Llongyfarchiadau Jen, a diolch. Thank you for all that you are doing to utilise and promote the Welsh language in your workplace. Llongyfarchiadau a diolch yn fawr iawn to Nicola Drake and Rose Harris for being highly commended and to all the other nominees in the category. Diolch yn fawr iawn I bawb a roddodd o'i amser I gydnabod brwdfrydedd ac angerdd ein staff wrth ddefnyddio a hybu defnydd o'r Gymraeg ar draws ein Bwrdd Iechyd. Thank you.
Hello, my name is Hugh Thomas. I'm the Executive Director of Finance at Hywel Dda University Health Board. Helo, yn enw yw Hugh Thomas, fi yw cyfarwyddwr cyllid y Bwrdd Iechyd yma yn Hywel Dda. I'm the executive sponsor of Hywel's Applause Innovating and Inspiring Practice Award category. This award is for a team or individual who's made a change which has had a positive impact on staff, patients, or care. The criteria for this award are that they have demonstrated innovation or having made a change across the organisation, improved a work process or system, ensured that any changes were made in line with policies or best practice guidance, and work together across different roles or settings in a multidisciplinary approach to make that change. I'll now hand over to Chris Hopkins to present the nominations.
Hi everyone, I'm Professor Chris Hopkins. I'm Head of Innovation and the Tritech Institute within Hywel Dda University Health Board. And I have the absolute privilege of presenting this year's Innovating and Inspiring Practice Award on behalf of the judging panel. Innovation can be defined as the application and the creation of new knowledge, and we want everybody across Hywel Dda to have a part to play, particularly around innovation and improvement. So this year's three finalists are
the Occupational Therapy Team, St Non's Ward, Pembrokeshire, to support Alzheimer's and dementia patients that can experience difficulty in communicating their wishes or could have a limited understanding of their environment and the treatment they're receiving. The Occupational Therapy Team introduced bespoke, personalised patient flashcards which have helped patients to have a voice. The Diabetes Dietetic Team, Health Board wide, since the COVID-19 pandemic, the Diabetes Dietetic Team have developed and implemented the Type 2 Diabetes Remission Service virtually, which enables equitable access across the Health Board. The team have helped 43% of the patients enrolled onto the programme achieve diabetes remission, brought about cost savings through reduced medication requirements, and their work has been showcased at an all-Wales level. Sarah Pask, South Ceredigion Cluster Frailty Nurse. Sarah has set up a health visitor service for older adults in Ceredigion. The service provides a full frailty health assessment and medicine review, which releases GP time.
And the winner is Sarah Pask, South Ceredigion Cluster Frailty Nurse. Sarah's innovation and leadership has developed this multidisciplinary approach and had a positive impact on patient care. Her work has reduced unnecessary medication wastage, promoted collaboration between the relevant teams involved in patient care, and improved the working relationship and communication with community pharmacies. During the COVID pandemic, Sarah, along with the National Exercise Referral Scheme team, sourced funding to obtain DVDs called Move It or Lose It to encourage patients to continue with their activities whilst being unable to attend their fitness classes. Today, the impact of Sarah's work offers incredible value to the patients in Ceredigion, which has the highest proportion of elderly patients across the Health Board. Diolch.
Shmai, my name is Jo Wilson and I'm the Director of Corporate Governance within Hywel Dda University Health Board, and I'm the Executive Sponsor for the Supportive Colleague Award category. This award is for an individual who goes the extra mile to help and is always there to support colleagues and has a positive impact on their colleagues' day. In fast-paced environments, these colleagues can make all the difference in our experiences at work, so it's vitally important that we recognise their contribution to helping us all to have a good day at work. I will now hand over to Lisa Marshall, the specialist panellist for the Support Colleague Award, to present the nominations and announce the winner.
Shmai, hello, my name is Lisa Marshall. I'm the Senior Sister on the Frailty Unit in Withybush Hospital. We had extremely high volumes of nominations for the Supportive Colleague Award, which reflects the outstanding impact supportive colleagues have on their fellow team members every day. Thank you to everybody who took the time to submit the nomination for Supportive Colleague Award. Shortlisting the award was difficult for myself and other panellists, but we're looking at the individuals that have support and help colleagues beyond the requirement of their own, demonstrate exemplary compassion for their colleagues, and have a positive impact on their teams every day by being supportive to everyone. In no particular order, our finalists are Catherine Jones, midwife, Gwenllian Ward, Bronglais Hospital. Catherine is the wellbeing champion and the ward coordinator. She's very approachable and is always an ear when times get difficult, both in work and in the team members' personal lives. She gifted each member of staff, roughly around 30, a seedling, which she has potted at home for them to grow. A lovely idea has become, and it's like a little competition who can grow the biggest seedling. She ensures that the team all have adequate breaks on shift and covers numerous shifts herself. David Rogers, the manager of Tebring Gwyn Hospice in Prince Philip. David is supportive of everyone that walks through Tebring Gwyn building. The team all enjoy coming into work since David has encouraged the staff and increased their confidence in taking on courses and responsibilities. When patients, families, friends and staff have had a difficult day, David always makes sure the team have time to reflect and feel supportive. Jenna Abbott, Senior Library Assistant, Withybush Hospital. Jenna always goes above and beyond to help people. Even those times she is unable to help directly, she will find out who can help and help them get in contact with that person. She will pause her work and make sure you are able to complete your tasks successfully. Congratulations to all the nominees and finalists. I will now pass you back to Jo to announce the winner of the Supportive Colleague Award.
Thank you, Lisa. The winner is Jenna Abbott, Senior Library Assistant at Withybush General Hospital. Huge congratulations to you, Jenna, so well deserved. Jenna is a very supportive colleague and has been there for colleagues through difficult life events. She takes time to listen to people and understands how best to support them. Congratulations, Jenna, and thank you for taking the time to listen to your colleagues and support them through challenging times. Congratulations to David Rogers and Catherine Jones for being highly commended, and to all the nominees. Thank you to all the nominators for taking the time to recognise the outstanding individuals that take time to go the extra mile for their colleagues and really make a difference to their day.
Hello, my name is Jill Patterson and I'm the Director of Primary Care, Community and Long-Term Care Services for the Health Board. I'm the Executive Sponsor of the Patient's Voice Award category. As a health board, we value feedback and from our patients so that we can learn from those things that we have done well and learn about those things that we can improve further. I will now hand over to Jeff Bowen, the specialist for the Patient's Voice Award, to present the finalists.
Hi, for those of you who may not already know me, my name is Jeff Bowen and I'm the Head of Patient Experience for the Health Board. Thank you to all the service users that have taken the time to provide us with feedback on the services we provide. We receive a great number of compliments for our staff, which reflect the values shown every day when carrying out their roles. Shortlisting for the awards was very difficult for myself and the other panelists, but we were looking for a team or individual that has provided excellent care and has had a positive impact on a patient, a service user, or their family or carers. In no particular order, our finalists are Accident and Emergency Department, Bronglais Hospital, Aberystwyth. For the empathy, care and compassion that the team has shown to patients and their family, the team made them feel supported throughout. Amy Griffiths, ward sister, Bryngolai Ward, Prince Philip Hospital, Llanelli. For the advice, support and kindness provided during a very difficult period of a family's life. Amy made them feel accepted, understood, when they felt like it was too much to cope with. St Non's Ward, Haverfordwest. For the support provided to a patient and their family
in the last few days of the patient's life. The family felt very welcomed and comfortable when they visited the ward.
Congratulations to all the nominees and the finalists. I will now pass you back to Jill to announce the winner of the Patient's Voice Awards. Thank you. Diolch yn fawr.
Thank you. The winner is Accident and Emergency Services, Bronglais Hospital. The team at Bronglais A&E demonstrated exemplary values. The team delivered difficult news in a kind and compassionate way and supported the family with their options as the relative moved towards end-of-life care. The compassion, integrity and respect shown by the team enabled the family to feel supported and made a significant difference to how the family were able to deal with the heartbreaking situation. As a community, we are so lucky to have healthcare staff like them. And thank you to all of our service users for taking the time to recognise the great work which you have experienced or witnessed.
Shemai, my name's Phil Claw. I'm the Interim Chief Executive of Hywel Dda University Health Board, and I am the Executive Sponsor for the Wellbeing Awards category. As a health board, we know the importance of wellbeing and strive to support the wellbeing of staff and our patients, as you cannot pour from an empty cup. We want to celebrate the great enthusiasm and effort of our staff across the health board who demonstrate a positive impact on the wellbeing of staff and patients beyond the requirements of their role. I will now hand over to Karen Ryan, the specialist panellist for the Wellbeing Award, to present the finalists.
Shemai, my name is Karen Ryan and I'm the Head of Occupational Health. Thank you to everyone who took the time to submit a nomination for the Wellbeing Award. We received a great number of nominations which reflected the enthusiasm and flair staff have to support the well-being of their colleagues. Shortlisting the award was difficult for myself and the other panellists, but we were looking for an individual that supports colleagues beyond the requirements of their role, demonstrates exemplary compassion for their colleagues, and has a positive impact by being supportive of others. In no particular order, our finalists are Kylie Martindale, Ward Administrator, Rhiannon Ward, Bronglais Hospital. Kylie is always finding new and fun ways to bring the team together to ensure everyone has a release from work pressures. From fancy dress Zumba to running, walking, race for life, Kylie always has a high uptake of staff who want to join her in whatever fun new activity she plans. Sian Retta, podiatrist, Cardigan Integrated Care Centre. Sian is a wellbeing champion and is actively involved in wellbeing workshops at both Aberaeron and Cardigan Integrated Care Centres. Sian promotes conversations with both staff and patients about their mental health and wellbeing, signposting to services in health and third sector for support. She has normalised having a conversation for mental health first aid and suicide prevention and awareness within the department. Sian has also started a new service with Gowelian to offer podiatry to patients within mental health services to enable access for hard-to-reach patient groups. Tina Jones, Ceredigion County Administrator. Tina is a wellbeing champion for the integrated building, ensuring primary and community care are all included. Tina developed a wellbeing board asking staff what would help them in the workplace. Tina also coordinated a wellbeing day on International Nurses Day, using contacts in and out of work to ensure a broad range of activities and information was available. By drawing on a broad range of groups, Tina ensured that the wellbeing days appeal to a wide range of staff. Having a therapy dog was ingenious. Staff enjoyed sitting with him, decreasing stress levels immediately. I will now pass back over to Phil Clare to announce the winner of the Wellbeing Award category.
Thank you, Karen. The winner is Sian Retter, podiatrist at Cardigan Integrated Care Centre. Sian's work has had a great impact on staff and service users. It has enabled signposting of service users to access mental health organisations. Patients have gained access to treatments they would otherwise have gone without, such as addressing the root cause of foot issues. Sian's work outside of work has also started LISS, Living in Suicide's Shadow support group for people bereaved by suicide, and Sian organises walks, support meetings and a platform for families. Recently, Sian was involved in a project in London to highlight conversation for suicide prevention, using impactful images of people smiling and laughing in the days before dying from suicide with mind and mental health charities.
My name is Lee Davis and I'm the Executive Director of Strategy and Planning at Hywel Dda Health Board, and I'm the sponsor of the Rising Star Award category. This award is for an individual who has had an outstanding positive impact on the service outcomes of their department. Important evidence criteria for the Rising Star Award includes going over and above to exceed the expectations of their role, is enthusiastic and driven to achieve, has had a positive impact on the service outcomes of their department.
Shwmae pawb, yn enw I yw Undeg Jameson, a fi yw arweinydd ffisiotherapi cymunedol yma yn Sir Gar. Diolch yn fawr iawn I bob un ohonoch sydd wedi ynebu unigolion ar gyfer y wobr y Rising Star. Rydym wedi derbyn nifer fawr iawn o enwebiadau a mae wedi bod yn bleser fawr I ddarllen trwyddo pob un ohonom. Mae'r safon wedi bod yn erythrol o uchel a mae wedi bod yn anodd iawn I grybwyll y rhestr yn fyr. Ond dyma ni, fel pwyllgor, ni wedi dod I benderfyniad a dyma ni'n enwebu yr unigolion gorau yn y categori y Rising Star.
Our first nominee is Hayley Thomas, Junior Sister in ITU in Glangwili Hospital. Hayley is an inspirational leader and is always willing to help others. She thrives on developing her fellow nurses and students. Her determination to develop services for the benefit of our patients finds her as the link nurse for 3 key projects at the moment and is always keen to take on other roles, always thinking outside the box. Hayley believes that her workforce is the service's strongest asset and is always going above and beyond for their benefit as well as her patients and relatives. When a patient was recently in ITU, she recognised the tremendous impact that it also has on the relatives of the patients under her care. A recent family was extremely grateful to Hayley when she bought items for the family as they stayed with the patient overnight. Our second nominee is Jane Davidson, a healthcare support worker working in St Brynachs in Pembrokeshire. Jane demonstrates the health board values to an exemplary level. Jane recently went over and above what was expected of her to support an elderly lady at home. This lady did not have any close friends or family nearby, despite living in the area for most of her life. Jane would visit her before and after work to ensure that she had food, heat, had attended to her personal care and taken her medication. She would support with the shopping and tidied her home to ensure it was a safe environment for this lady to live in. Jane was the only person this lady trusted, and they formed a strong alliance and therapeutic relationship, enabling her to stay at home and achieve what really mattered to her. Our third and final nominee is Molly Evans, a mental health nurse working in Bryn Gofal Ward, Prince Philip Hospital. When patients display challenging behaviour on the mental health ward at Bryn Gofal, there is often an underlying need or desire behind the behaviour that is not being met. During a period when patients are displaying challenging behaviour, Molly utilises her expertise and excellent communication skills to establish what exactly the unmet need or desire is and de-escalate them, often managing to support individuals to adjust their mindsets and perspectives on the issues that affect them on that day.
The winner is Molly Evans, Mental Health Nurse, Bringothal Ward, Prince Philip Hospital. Molly is an excellent mental health nurse. She embodies some of the best aspects of the Nursing and Midwifery Council Nursing Code and Hywel Dda's core values. She's already working towards some of the 4 pillars of advanced nursing practice. Is a practice supervisor working towards being a practice assessor, a blood glucose trainer, and is already looking to progress to the next level. She's very professional, driven, hardworking, a bilingual communicator, empathetic, kind, supportive, understanding, passionate, and has calon. People respond well to her as she is genuine, relaxed, and engaging. She's insightful and possesses good psychological understanding, an inquisitive, keen mind, and adapts her approach to suit patients and also staff needs. She is emotionally intelligent and utilises this to understand patient perspectives and identify underlying patient needs. Molly has a calm, fun, vivacious personality combined with a professional attitude which makes people feel comfortable, happy, and supported around her. She also has a strong work ethic, is passionate about her work within mental health and helping patients to recover and empower them to lead successful lives. She has a positive attitude and is a strong support and advocate for patients. Molly has very good communication skills and an understanding that they are one of the strongest tools within a healthcare professional's toolbox. She utilises these to build successful, trusting, supporting, therapeutic relationships with patients. Patients might often forget the words you say to them, but they never forget the way staff make them feel. Congratulations to Molly, and thank you again for your contribution to our mental health service. Congratulations also to Jane and Hayley for being highly commended, and to all the teams that were nominated. Thank you also to all nominators for taking the time to recognise the great effort and enthusiasm colleagues have shown to have a positive impact on patient care across the health board.
Hello, I'm Lisa Gostin, the Director of Workforce and OD, and I'm the Executive Sponsor for Howell's Applause People Development Award category. This award is for the team or individual who has engaged with developing themselves or others, which has had a positive impact on the service that they provide. I'd now like to hand over to Gemma Littlejohn, who will present the nominations and announce the winner.
Shemai, my name is Gemma Littlejohns and I'm the Learning and Development Manager within the Health Board. Thank you to everyone who took the time to submit a nomination for the People Development Award. The nominations we received demonstrated commitment to development that is apparent across the whole Health Board, and it was great to read about the support people had received and the commitment to development that staff had shown. Shortlisting the award was difficult for myself and the other panellists, but we were looking for individuals or teams that developed a skill which they can use within the workplace, or improved their ability to carry out their role, gained a qualification or accreditation, supported someone else with their development, or taught someone else a new skill. In no particular order, our finalists are
Ffion Lloyd-Thomas, podiatrist at Glangwili Hospital. As well as being an excellent podiatrist, Ffion has become a basic life support tutor. She is now able to teach these vital life support skills to the podiatry team, which is a mandatory skill they must renew every year. Ffion keeps everyone up to date and takes time to organise and coordinate these sessions for the department. This reduces the workload of the basic life support team tutors, allows podiatrists to do their learning as part of their team meetings, and reduces the time needed to attend courses individually, ultimately allowing the team to spend more time with patients. Judith Bowen, Lead Clinical Informatics Nurse, Withybush Hospital. Judith has overseen the digitalisation of the Wales Nurse Care Record in Hywel Dda. Her work has enabled nurses to use digital technology to complete records quickly, which enables them to spend more quality time with their patients. OSCE Training Team, Clinical Education. The OSCE team were initially set up to train 100 internationally educated nurses with no trainers, venues or resources available to them.
They quickly established themselves, creating scenarios, developing training plans, and sourcing equipment. In less than 12 months, they managed to get the 100 nurses through their OSCE training and obtaining their PINs. Congratulations to all the finalists and the nominees. I'll now pass you back to Lisa, who will announce the winner of the People Development Award.
Thank you, Gemma. The winner is the OSCE Training Team Clinical Education. Prior to the arrival of the first cohort of overseas nurses, the Health Board had 400 registered nurse vacancies, and the Glangwili Hospital site was particularly vulnerable in terms of its workforce. With 100 nurses trained, Glangwili Hospital is now stable, which has had an impact on both patient care and the large nurse agency bill. The next phase will see another 140 nurses arrive between March 2023 and 2024, and these numbers will be trained and added to the Withybush Hospital workforce, which in turn will stabilise staffing numbers, improve patient outcomes and reduce the agency spend. And so, congratulations to Fionn Lloyd-Thomas and to Judith Bowen for being highly commended in this category. And of course, congratulations to our OSCE Clinical Skills Training Team for winning this award.
Shemai, Mandy Ydwi. Hello, my name's Mandy Rayani, and by the time you're watching this video, I will have retired from my role as Exec Director of Nursing Quality and Patient Experience within Hywel Dda. Nevertheless, I was the executive sponsor for the Unsung Hero Award category. In Hywel Dda University Health Board, we recognise that every member of staff has an important role to play, and that is so that we provide the best possible care and services for our population and our community as a whole. I would like to thank every member of staff for the hard work and the contributions that they make. And I would like us to say a special thanks to you, to our volunteers, who commit time, unpaid, and to support us in delivering the best possible services. This award is for a non-registered individual who has a positive impact on patients and colleagues through little behaviours, the things that they do, and they are embedded into their way of working naturally and every daily activity that they undertake. I'll now hand over to Claire Steele, the specialist panellist for the Unsung Hero Award, to present the finalists.
Shemai, my name is Claire Steele and I'm the Future Workforce Manager. Thank you to everyone who took the time to submit a nomination for the Unsung Hero Award. We received an incredibly high number of nominations, which reflect the outstanding work staff are doing across the Health Board. Shortlisting the award was difficult for myself and the other panellists, but we were looking for a staff member or volunteer that demonstrates exemplary Health Board values, has a positive impact on patients or colleagues, and continues to do their best and have a positive impact on people around them, even if their day is tough. In no particular order, our finalists are Augusta Stafford Umugeli, Workforce Culture, Diversity and Inclusion Manager. Augusta is passionate about ensuring that people are treated equally regardless of background or skin colour. Augusta's role, whilst positive, often means that she is a sounding board for colleagues who are facing discrimination and racial bias. As a woman of colour herself, Augusta often has to relive her own past experiences in order to support her colleagues. Despite this, Augusta always exudes love and positivity. She comes to work with an aura of kindness and grace and is an integral part of her team. Lindsay Dobson, Audiology Administrator, Bronglais Hospital. Lindsay carries out a patient-focused role in outpatients audiology. The role encompasses a range of tasks for different people. Lindsay is a clinical coordinator, which involves managing waiting lists and booking appointments for people with hearing loss in the community. Lindsay is often the first point of contact when patients are experiencing hearing difficulties. Lindsay willingly supports by going beyond her role to support a colleague with hearing loss to communicate via the telephone with other staff and patients. Sian Davis, Healthcare Support Worker and Howard Ward, Bronglais Hospital. Sian is a great asset to the team. Sian comes to work every day with enthusiasm and ideas to improve staff well-being. Sian's main priority, however, is the families and children that we look after. Sian has such a positive impact on patients and staff alike. She goes out of her way to ensure everybody that she comes into contact with feels supported. Congratulations to all nominees and finalists. I will now pass you back to Mandy to announce the winner of the Unsung Hero Award.
The winner is Sian Davis, Healthcare Support Worker, Angharad Ward, Bronglais Hospital. Sian always provides the best care she possibly can for the children and their families. By doing so, the families leave the ward feeling empowered, happy and rested. She is a wellbeing champion and is a pillar of support for all of her colleagues. Sian helped implement a Feel Good Friday box, a weekly lucky dip with little items to improve staff wellbeing, including simple things like pens, lip balms and hand creams. It gave everyone a little something to look forward to each week. The energy and effort she puts in every day makes everyone's day a little brighter. Parents and children love her just as much as the team do, and the ward simply wouldn't be quite the same without her there. Congratulations, Sian, and thank you for demonstrating the Health Board values to such a high degree in all that you do. Congratulations to Augusta Umageli and Lindsay Dobson for being highly commended, and to all the nominees. Thank you to all nominators for taking the time to recognise the great demonstration of Health Board values that you have witnessed or experienced.
Shemai, my name is Ardiana Gini and I'm the Director of Public Health within the Health Board. I'm the executive sponsor of the Diversity and Inclusion Award. This award is for a team or an individual who have gone beyond the requirements of their job in order to have a positive impact on equality, diversity and inclusion for our service users and our staff. The award aims to celebrate the work going on across the Health Board to improve equity, equality, diversity and inclusion for all our service users and our staff. I will now hand over to Augusta Umageli, the key panelist for the Diversity and Inclusion Award, to present the finalists.
Shemai, my name is Augusta Stafford Umageli. I'm the Workforce Culture, Diversity and Inclusion Manager. Thank you everyone who took the time to submit a nomination for the Diversity and Inclusion Award. The nominations we received demonstrated the great work that is going on to improve equity, equality, diversity and inclusion provision across the Health Board for service users and staff. Shortlisting the award was difficult for myself and the other panelists, but we were looking for individuals or teams that promote inclusive participation and eliminate discrimination, have developed an innovative initiative or project that promotes equality, diversity and inclusion, have developed an innovative response to an equality, diversity and inclusion issue, have improved equality, diversity and inclusion provision across the Health Board for service users and staff. In no particular order, our finalists are Community Development Outreach Team, Health Board wide. The Community Development Outreach Team continually breaks down barriers and supports individuals from different backgrounds to access healthcare and other information that is beneficial by signposting and referring to those agencies that can help. The team recently organized a day for Gypsy and traveler communities to promote winter well-being. It was an opportunity for people to connect with organizations and get the information they needed to have a safe, warm winter. Kath Stroud, Best Interests Assessor. Kath has been promoting the use of sign language within the Health Board and using her knowledge of British Sign Language to support staff development. Kath has engaged with several activities to promote BSL, which include running a BSL lunch club, recording a message to promote Sign Language Week, and attending the Health Board's Sensory Loss Partnership Forum. Older Adults Mental Health Team, Pembrokeshire Community. The Older Adults Mental Health team introduced a virtual reality mental health intervention to support older people experiencing suicidal thoughts. The patients received a tailored VR experience, which has had a positive impact on elderly patients in the community. Congratulations to all nominees and finalists. I will now pass you back to Ardiana to announce the winner of the Diversity and Inclusion Award.
And the winner is Kath Stroud, Best Interests Assessor. Kath's message to promote British Sign Language Week in BSL on social media has inspired members of staff to know more about BSL and available training and resources on sign language. A number of staff were also inspired to practice their skills. Kath ran a BSL lunch club for staff, which has had a positive impact and was greatly supported by the facilities team, which provided the venue. At the event, there was lots of positive feedback from staff about how the club and support from Kath helped them practice their BSL skills. Kath also has started attending the Health Board's Sensory Loss Partnership Forum and has generated discussions about how the Health Board can best improve services for people whose first language is BSL. Kath's enthusiasm and selfless commitment to improving staff awareness of BSL and the needs of BSL users is inspirational.
Congratulations, Kath, and thank you for working on this innovative initiative to promote equality, diversity and inclusion for BSL service users and staff. Congratulations to the Older Adults Mental Health team and to the Community Development Outreach team for being highly commended. Also, congratulations to all the nominees. Thank you to all the nominators for taking the time to recognise the great commitment that our teams and the individuals have shown and continue to demonstrate as we strive to improve equality, diversity and inclusion across our health board.
Shemai, I'm back again as I am the executive sponsor of Howell's Applause Lifetime Achievement Award. The Lifetime Achievement Award is an accolade that's given to an individual who has made an outstanding contribution to the NHS during their lifetime. We have a tremendous number of staff that go over and above to ensure that our services are the best that they can be for our population. Thank you to everyone who took the time to submit a nomination for the Lifetime Achievement Award. This year, we received a large number of nominations, which reflected the outstanding contribution that individuals who work for Hywel Dda had on the NHS and the care we provide for our service users and our staff. Shortlisting this category was really difficult this time, and the other panellists found this challenging, but we are looking for an individual who has demonstrated commitment to the NHS with their long service and has had a positive impact on the service we provide and has improved the experience of patients and staff. In no particular order, the finalists are
Alison Thomas, Grow Your Own Manager. Alison has almost 40 years NHS service and has worked in many roles. In her current role, Alison supports our healthcare support workers to undertake the Level 4 certificate in higher education, Cert HE, and the part-time nursing degree. She is responsible for the interviews and is the liaison with Swansea University for the successful candidates. In 2022, Alison's role developed further, where she was allocated the All Wales project to receive 100 overseas nurses. She now manages the OSCE team, OSCE, and the students that come to us from all over the world. The team are now based in Building 2 on the St David's Park campus in the old canteen and has a fully equipped OSCE suite. Prior to this, Alison was the bank manager. She managed the office and the team to liaise with services and allocate staff to cover the deficits in shifts for registered and unregistered staff to be able to support services to provide safe and good quality patient care. Alison has seen many changes over the last 39 years and has been instrumental in the training and development of our future nurses. Nan Davis, healthcare support worker, Hedvan Older Adults Community Mental Health Team. Nan has 47 years service in Hywel Dda Health Board, working in various healthcare settings, providing care for individuals accessing mental health care services. She commenced her career in the Health Board in 1976 on St Anne's Ward in St David's Hospital. She also worked on other units throughout this hospital, such as Dyad Ward, Ystwyth Ward, Morlais Ward, Hedvan Ward, and Ffynnon Drain Housing, which provided care for service users following the closure of St David's Hospital. Nan has also worked at Bryn Tirion and Bryngolai Ward at Prince Philip Hospital. For the last 10 years, Nan has been working within the Older Adult Community Mental Health Team in North Carmarthenshire, providing care and support to individuals with complex mental health needs. Nan has dedicated and committed 47 years to her duties as a healthcare support worker for the Health Board. Nan is admired, loyal, kind and compassionate individual who demonstrates Hywel Dda's Health Board's values and truly makes a difference to the service users she comes into contact with. Nan provides quality care to individuals and their carers accessing Older Adults Community Mental Health Team. Sue Morgan, Assessment and Verification Coordinator. Sue started her career in the Dyfed School of Nursing in postgrad in Bronglais Hospital in 1980 and has taken several roles during her career, including being a nurse and an assessor. During Sue's time in her educational role, she has been instrumental in the development of healthcare support worker education. She was part of the team that developed the first clinical induction programme and its accreditation. Sue has developed the education and training across the footprint of Hywel Dda through all its changes and developments over the years. She is very passionate about the delivery of education and the development and recognition of healthcare support workers to deliver safe and effective care to their patients. Over the years, Sue has delivered education to over 5,000 staff. She continues to be part of the healthcare support worker development across all disciplines and has developed work-based learning and accrediting units such as physiological measurements, blood glucose testing, personal care and specimen collection. Along with the development of the clinical induction that is today, it is started off as a thought and a concept from basic skills to BSc, supporting the healthcare support worker workforce to be recognised for the role that they undertake in the delivery of care to patients in our community. Currently, Sue is supporting the assessors and quality assurers that are delivering and accrediting the learning that the healthcare support workers are undertaking. And the winner is Nan Davis, healthcare support worker, Hedvan Older Adults Community Mental Health Team. Nan is looked up to by her work colleagues as an inspiration for her dedication to providing support and reassurance, as well as having a great impact utilising her culinary skills, providing a cake or two for staff members on special occasions.
Congratulations, Nan, and thank you for your dedication to caring for our service users. Congratulations to Alison and Sue for being highly commended, and to all the nominees. Thank you to all the nominators for taking the time to recognise the great commitment and dedication that colleagues have shown to the NHS. A special thank you to the panellists who took their time to read through the nominations and also shortlist them, and also to the team that have worked tirelessly to plan, film and produce Howell's Applause 2023.
Forever.